Hello and
Hello.
welcome to Full Tech Ahead. I am your host, Amanda Razani, and with me today I have Dr. Jeff Dello Russo. How are you doing today?
I'm doing very well. Glad to join you on this to chat about exciting developments in my field, our field.
Absolutely. Well, can you share a little bit about yourself, your background, and your
Yeah.
practice?
Yeah. Well, I'm an ophthalmologist here in New York City and surrounding um, for, I guess it's been 26 years now, a little while. And I've been around for a number of progressive steps, technologically speaking, within refractive surgery, vision correction surgery, mostly involving lasers, but also other platforms that we use, which are non-laser. And that's been very exciting. We have practices that I sort of supervise. I'm the chief medical director and sort of primary surgeon across the tri-state, New York City, all the boroughs, Westchester County, throughout New Jersey, also into Connecticut. So I see what it's like for you know, vision correction to be brought across a very large swath of the most sprawling metropolitan area there is. So it's been a life of innovation and education here.
Fantastic. Well, we're here to
Yeah.
talk about that today, especially how AI technology has impacted your practice and the industry. I think you have a advanced LASIK procedure now that utilizes AI, and I'd love for you to share about that.
Yeah, I mean, it's kind of crazy how this came together, sort of sooner than we thought. It's the merging of laser technology and artificial intelligence to incredibly powerful leading edge um, platforms. So now what we have, um, and this could have, I guess, existed a couple years ago, except the computing power wasn't quite there to make it realistic, in a patient-centered type of approach. But what we have is we have a device which is able to capture an incredible amount of information about the eye. Um, it's kind of like just staring at any type of diagnostic device you might see I mean, it looks fancy, but at the end, from the patient's experience, you're just looking at a light source and it's scanning the eyes one at a time. And what it does in the process of scanning, not just the surface of the eye where the laser correction happens, sort of the whole eye an, as a nervous system element. It sort of scans the entire eye front to back. It used what's called ray tracing technology, so it's shooting a lot of lights, beams of light, thousands of them, tens of thousands actually, into the eye, creating in that study like a virtual sort of avatar. It's like a virtual clone of the eye, which is great. It generates that clone, and then it tests an incredible amount of corrections against it to find that, because every eye, of course, is different, right? Even between two people's eyes, but the ocular system it's a bit different, and it's able to bounce off these light rays and come back and model out a bunch of treatments, and it goes through a huge array, thousands and thousands of treatment till it finds the perfect fit to fully maximize the vision in an eye and sort of take that sort of front to back entirety view and test out all these treatments on that digital sort of clone avatar, however you want to call it, and then feedback. It doesn't take long. I mean, it takes for a computer, it's long. It takes 5 minutes to sort of generate and go through and try all of those prescriptions and feedback. You know, an enhanced treatment for the eye that should bring the vision past what a person's experienced. So it's exciting, obviously. It also bakes in
Yes.
some of the simple things that we do, the better one, better two, this device right there. That's not part of it. So we're making sure that we know that we're going to take the base amount of treatment that comes off this, that's called the phoropter, everyone's been in front of one, and overlays an AI component delivered by the device to get that enhanced vision that takes you past just a simple eyeglasses and contact lens type of um, paradigm. Goes into the next level, which really, and of course, these things are, it's the United States, everything's clinical trials and FDA approved. In the treatment group that was done, for the recent improvement for that device that's powering the technology. Um, Over the many, many eyes that were treated, 100% of people reached 2020, which is astonishing that 100% would do so. But that's just sort of the entry level of it. Truth is, vast majority of people went to visions that are even more higher visual performance, getting to the lowest levels on the chart that people wouldn't even really be shown. 2015 vision, 2010 vision. I don't want to say it's a bionic vision, but it's a little bit like that. A lot of the eye charts that come loaded don't even have that in the projector. So, the 2020 is like the baseline, which is amazing. And we're delivering vision that people haven't seen. So it's
Wow.
been an exciting rollout, and everything that was in that study that backed this. Um, every patient that we've treated so far, which has been many, I guess we've had it a little over a month, 6 weeks, whatever it's been, have achieved that vision. So it's really upping the game, so to speak, in terms of the vision that can be achieved with a corrective surgery. Sorry, that
Wow.
was a long, long sentence, but that gets a little
Yeah.
bit.
No, that's amazing. So before you were using AI, incorporating AI, were you ever able to achieve that level of precise, perfect vision or better than the 2020 vision before using AI?
Yeah, I mean, it's a little bit of an iterative thing. I mean, there's obviously things that we measure by hand, the old sort of traditional ways of measuring, and then there has been in different forms over the last, say, 15, 16 years, technology to be able to map the front of the eye. You know, in addition to the prescriptions we get, there's advanced mapping that looks at the eyes, of course, front to back, also on the surface of the eye. There's irregularities, no corneal surface is exactly the same, right? So we're able to map that, and that's been a technology that exists before sort of artificial intelligence came into it and the sort of more high-powered compute. So that has been going on, and and truthfully, I mean, the reality is, even on the most simple, going back to the earliest days of laser vision correction, there were a pretty decent percentage of people that went past 2020 with, correction. But now, along the way, and different versions that pre-existed the AI sort of leap here, that sort of front surface measuring, we call it topography, that was able to measure all those points on the eye and put together. That existed in a prior form. We had results that were quite great. A decent, significant percentage of the people were able to get past the 2020 level. But now it's just the preponderance, as you can just model out so many treatments before doing it. And, the artificial intelligence is able to point out the treatment profiles that would just maximize the eye as a whole system by testing on that clone. So, yeah, it's definitely putting a huge percentage of people into that beyond 2020 zone. Not that we didn't have a fair amount, but now like it's quite reliable in that way.
That's amazing. So quite precise, and obviously seems like more efficient, a more efficient process too.
Yeah. I mean, it is because there are people that not everyone is so great at going through the better one, better two type of traditional measure. There are people that just can't pick or they're not great participants in that process. So it takes that out of it too, as well. I mean, of course, we do that, but we're also getting the overlay of the non-subjective, non-patient cooperation, not patient input of better one, better two. That's part of it as well, but sort of creates that efficiency where you can take out a mix people that can't do that quite as well.
Hmm.
So that's part of that. I mean, look, it slows things down slightly. We're talking about minutes. It's not like a big delay because, it takes time to process the image. The computer takes time to run it. So it's a little bit less efficient from the moment of door to door. It's all quick, talking about minutes for the procedure, you know, in any of its form. But that it's efficient from my standpoint in terms of being able to reliably know who's going to beat 2020 and what we can offer. So that definitely, from a confidence standpoint, is an efficiency.
Hmm. So, is this a common piece of technology that anybody can get a hold of, or is this a special technology that only you have at the moment?
I mean, I only have it now in the New York area. They're made, it's just like lasers. These are sort of made, I don't want to say by hand, but slightly. So there's not an infinite amount of these. But, over time they'll be rolled out. It's only on a certain laser, it's only on a certain laser platform. It's not like something, so it's kind of like a plug-in. So, it's connected to that laser. You can't just plug it into some more obscure laser platform or something like that. But they're coming to market. This should be common in every major area or minor area, in the country. It's they're going to be out there as they're rolling out. It's called Wavelight. That's the company that makes it. Um, and they sort of have the lion's share of the laser and LASIK platforms on the market out there. So they're in a position to do this as a scale matter to really be able to afford to make that investment in the AI and making that happen. So, it should be, I would imagine the results are so good, it's going to, of course, the market chooses, right? So it'll be commonplace in a relatively short period of time. I think so.
Awesome.
Months, maybe a year, everybody will have it. So,
Pretty quick. So,
yeah.
what do you envision as we know AI is advancing quite rapidly, as are some other technologies? So, what do you envision for the future? What's next, say, a year or two from now?
I mean, there's a lot of attention away from, lasers are part of vision correction and eye surgery and visual rehabilitation for eye disorders and cataracts and stuff like that. A lot of that's not laser based, or it's only partly laser based, like cataract surgery, which now has entered the era where we're using lasers involved with cataract surgery, which is a huge breakaway thing in terms of safety and reproducibility. And it's interesting because that laser piece of cataracts, and again, way more people have cataract surgery. And it sounds like it's just for, geriatric age, but it's done younger and younger. Just on the number of scale and just population um, skew. I mean, there's a whole lot more people that have cataract surgery than have LASIK or vision correction, just because of the demo. It's because everyone will eventually need it. So by like orders of magnitude, I don't know what the number is, something like 10x the amount of people have, vision restoration with a cataract surgery procedure than they do with LASIK. So that artificial intelligence is now making its way, which is no surprise, into the cataract surgery realm. So that affects a whole lot of people. Generally, the 50 plus, you know, which are sort of less served by laser treatment. Doesn't mean it's not done over 50, but preponderance of people are below that, the 18 to 50. But for that other sort of age group that's into the different needs, people's lenses become clouded at a certain age. Everyone's parents and grandparents have cataract surgery. Anyone listening would know that. So it's the most common procedure in all of medicine, period, cross category. Is cataract surgery. So tons of that is done. So thank God, and it's no surprise that AI is working its way into that. There's a lot of stuff like measurements that go into that involve for sure measuring the entire eye, a little bit like the AI is doing on the LASIK side, the laser correction side, to help optimize, find the perfect lens choice. So it's involved with that. So that's an exciting thing that's happening right now, and that's an exciting development to watch how artificial intelligence is going to affect that. So now we're going to have everybody from 18 to 89, whatever it is, and on, you know, will come in. And eventually eyeglasses, I'm sure artificial intelligence will be involved in that measurement. I'm just speculating on that, but I'm sure someone's working on that. Maybe
Yeah.
not me, but
Absolutely. Well, one more question. I know I've known a few people who have gotten LASIK, and they were informed that over a period of many years, their eyesight might change again or start to regress. But now, if you're using this precise AI measuring and you're getting even better than 2020, do you think would that then delay the eye regression then? Or in other words, if it's better than 2020, then they're still going to have really great eyesight many years later?
it's a good way to look at it. Yeah, like if you've seen 2015, 2010, the better than 2020, wouldn't that give it more life to it?
Right.
Yes, that's true. But also it's this thing, anything that improves the measurement. I mean, some of that's age dependent. Like when people are stable, that's patient selection. You're an age where everything's stable and you make the correction of whether you're getting 2020, 2015, whatever it is. got to be stable. It's not going to freeze the eye, so to speak. I mean, if you were destined to be worse, doesn't alter time, that part. But the more complete measurements, first of all, includes more candidates. And also, we'll have to see what happens with thousands and thousands of people. But I would imagine that that's going to have some impact on the life of the result. I think so. Just the more perfect measurements in terms of making this permanent as possible. But to be honest, especially when people are at a reasonable age where their stability has been established, the life of it is permanent. You see people
Okay.
now that have come in for routine stuff that had it done 30 years ago.
Oh, wow. Okay.
Sometimes more, not all
Great.
later, but different corrections like that. But so it's inclusive, and I think it's a good question. It adds to the permanence. So that's a good natural question that you thought of.
Yeah. All right. Well, if there was one key takeaway you could leave our audience with today, what would that be?
Just be that in terms of eye care, which is our most, I mean, I believe, um, you know, treasured sense that we have, artificial intelligence is here to help enhance those results and bring you past what you've been doing with your glasses and contacts. And if your parents are older and that's going to help with that age too. So really 18 up, artificial intelligence is already and increasingly will providing value and
Fantastic.
enhancing the
All right. Well, thank you so much for coming on the show and sharing about this technology and how it's impacting your practice.
pleasure to talk about it. Thank
And
you for
thank you
having
to
me.
yes, thank you. And thank you to our audience. Share what you found most interesting. If you have any questions, put those in the comments and have a wonderful day.